I'm John Hagan, co-host of Shift by Alberta Innovates, our podcast with a focus on Alberta researchers, innovators, and innovation. In the fall of 2020, Alberta Innovates announced $2.1 million to go towards research and innovation projects looking to slow down the spread and lessen the impact of COVID-19. Today I'm speaking with Dr. Jia Hu, chair of 19 to 0. His was one of 7 to receive Alberta Innovates funding. Welcome, Dr. Hu.
Thanks for having me, John.
Great to meet you. So your project is called Changing COVID-19 Behaviors Through a Data-Driven Targeted Marketing Campaign. Can you flesh that out and tell us a bit more?
Yeah, definitely. As somebody who works in public health, one of the critical parts of controlling the pandemic really is getting people to change their behavior. Whether that's staying indoors during a lockdown or whether that's getting a vaccine, since we don't really make people do these things, behavior change is critical. Now, when other companies do, try to get people to do things like buy Coca-Cola or, buy like fries, and their sort of marketing campaigns are extremely data-driven, right? They'll spend millions of dollars researching the consumer and, putting in front of them ads that they know will work. One of the issues, I think, with public health and government communications, even up to now, is that they haven't really been data-driven, right? It's very same message for every person as opposed to being segmented, not using the right channels. We really need to hit social media a bit harder because a lot of the younger people used to not be following the recommendations. And that sort of is the core of what this project, was meant to do.
Okay. So now when you say data and social media, is that primarily where that data is going to come from, is analyzing tweets and LinkedIn posts?
Yeah, so I think at this point, I view there's a few major data streams, but I bucket into what I call traditional and social media, right? So we've been collecting or coordinating the collection of most of the primary data, interviews, surveys, focus groups in the country, again, through some of that AI funding. And then you have your social media data streams, which is things like Twitter and CrowdTangle, which is Facebook, Instagram, TikTok data. And what we want to do is take all of that in and then sort of analyze, package it for the end user. Like, let's say we're making marketing or creative ads, but it's essentially really taking all the data that's available and collecting new data if we need to.
So once you have all of this data, what do you do with it? What's the next step?
Yeah, so as far as just that marketing campaign goes, what we do with all let's say we have a bunch of large sample size survey data and focus group data, we hand it over to sort of our marketing teams. We have many sort of people working on this, but they essentially do you might call it a cluster analysis, but it's what marketing policies call segmentation, right? And so, for example, an ad that works for a 22-year-old bartender may not work for a 40-year-old mother of 3. And so we split the population into segments, and then we basically, design different messaging based on sort of what those segments, what the data from those segments highlight. We actually have some really, really interesting, preliminary findings. We did this very, very small social media launch of some of our campaigns. And what we found is that we actually were able to connect with and engage the Albertans who are the most resistant to public health recommendations. So the group that public health could never actually ever reach. And we could also reach the group that was not the worst, but somewhere in between that and people who behaved a bit better. And it was a different type of ad. And it sort of it was extremely fascinating.
Now, Jia, you mentioned a couple of times Alberta Innovates and the support. Let me be self-indulgent here for a moment. Can you elaborate on what that support helped you do and helped you achieve with this project?
Yeah, I cannot understate how important that support has been in what we've been able to achieve to date, right? And so that grant was sort of like the first money our not yet named organization had. And again, initially it was for a data-driven marketing campaign, but now our work goes across a number of domains, including the social media work that I've mentioned. We have a dedicated behavioral science economics unit that sort of works throughout all of our projects. We have quite robust government relations and public relations arms, and then we have sort of what I call two societal engagement streams. One is the healthcare worker education engagement stream. The other is the community outreach stream. And I put it simply, on the healthcare worker space, we are basically more and more coordinating the creation of most, not all, COVID vaccine education material in the country.
Okay, so Jia, as you move through all of this and you're doing all of this activity, I suspect that you're starting to see results. Would that be an accurate assessment?
Yeah, for sure. I mean, I think, as I was sort of mentioning before, we, did a very, very small launch of some of our campaign materials on social media. And, essentially for less than $50,000, we were able to reach half of the Albertans who are known to be resistant to public health recommendations. And that is a group that I don't think that, Jia in his MOH hat could ever reach before, right? Like they just don't listen to us. And I think in some ways, again, with the social media side, like on the healthcare worker front, I mean, we sort of like are moving close to coordinating everything. And now our group gives out like 10 talks a week across the country on various things at least. And
Okay.
in my mind, this is still just the beginning, right? I mean, I think we are still early on in our existence as an
Mhm.
organization. We're still very early on in sort of vaccinating the Canadian population. But I think that, we are like, in other words, we're still really ramping up. But
Yep.
certainly, I think that we certainly are beginning to see not just sort of like the data pieces, where I think many groups do, but the development of those intervention pieces, which I think is
Right.
more critical side of things.
Dr. Jia Hu, we appreciate your time that you've taken to explain this to us. It's fascinating, and best of luck as you move forward with this.
Thank you.